This is Mike Sylvia with New Bedford Guide. We're here to discuss something very important, the opioid crisis, and a town hall discussion that's tomorrow at 6:30 at the Zeiterion Theatre. So I'm here with Craig Longo. He is the ER doc and co-founder of the Physicians to Prevent Opioid Abuse, PPOA. You've probably seen them a lot in the news. And we're also here with Denise Wood, who had lost her son to opioids, and we're going to ask a discussion. If you have any questions, go ahead and just post them. But really the big thing here today, folks, is you need to show up tomorrow at 6:30 at the Z. We don't need social media, changing profile photos and doing stuff to support opioid abuse. We need to go out and have a discussion about opioid abuse. So I'm going to start with you, Denise. Why don't you tell me your story and what happened with your son?
My son, Brett, was an addict, a heroin user. He started out with smoking pot, then it went to pills, and finally it was heroin. We fought this battle for many years. He was in and out of detox. And every time he went into detox, his answer to me was he always had to be high before he got to go in and get a bed. And so that kind of, perked me up a little bit, but there was nothing I could do. And I called and I tried very hard to question why to get a bed you had to use. And it went on, and tried to get him sectioned, couldn't do that. It took me a letter to a judge, 3-page letter, to get him to get sectioned. And I finally got him in, and this went on for about 7 years. And I lost the battle in 2012, February of 2012.
So you're going to be there tomorrow?
Yes,
definitely. You're going to talk about your son?
Yes.
So come out. There's going to be more people like Denise that'll be here to talk about their loss. But this event is really being led by the doctors. So there's been a lot of discussion about the responsibility of doctors in this whole crisis. And we've had a group of doctors, you probably read in the Standard Times, you've seen out in New Bedford Guide, that are really trying to take a lead in the South Coast and educate and have a discussion so that we can change things for the future, make it a better place. So Craig, so you tell me who you are.
Craig Longo. I'm the co-founder of the Physicians to Prevent Opioid Abuse, and I've been an emergency physician at St. Luke's for the past 7 years.
So what's going on tomorrow night? It's at the Zeiterion Theatre, starting at 6:30. What's it about?
So tomorrow night we have a great opportunity for people to come out and educate themselves, about this opioid crisis. Like we talked about, this is a crisis that is kind of multifactorial. It's not just about medicine, it's not just about law, it's not just about kind of psychosocial factors, it's a little bit of everything. And the goal for tomorrow night has been to kind of pull from all those pools and bring people together so that the community as a whole can kind of educate themselves on this crisis. If you haven't been affected personally, which far too many of us have, just living in the greater New Bedford community, this is a problem that affects us all every day, and it's not getting better. So the goal is to bring together some physicians with some expertise in this area, some of our emergency department social workers with some expertise in this area, some people who are in long-term recovery, and others who can kind of share their stories about lived experience and educate the community as a whole. The plan is to kind of review the current state of where we are today, especially from an emergency medicine perspective. We tend to be kind of the frontline providers for a lot of these. So we have Dr. Jen Pope, who is the chair of the emergency department at St. Luke's, will be speaking about that. I'm going to review some of the new laws that have been passed by Governor Baker in regards to opioid prescribing and how we think that's going to affect the landscape of this crisis. We have a pain management specialist, Dr. Gorski, who will be speaking about pain management and some alternatives to opiates, as well as some of our social workers in the emergency department. Pam Opheim-Newhall, Ryan Heap, and Connie Rocha-Mimosa will be talking about recognizing addiction and some of the resources that are out there and the role of Narcan in some of these treatment centers that we see, as well as Dr. Tom Bozzo, who works at Clean Slate, who will be talking about some of the medication-assisted therapies that we have to offer. We also have some people from the community. Chief Cordero from the New Bedford Police Department will also be there to kind of talk about the law enforcement perspective on the issue and what they're doing. And then we have some people who are just going to share some lived experience. Nick Correa, a friend of mine who's been in long-term recovery, will be telling his story. Attorney William Scannell out of Bridgewater, whose son Emmett unfortunately lost his battle with opioid addiction earlier this year, and he's been a powerful advocate for, really taking some of the stigma away from this crisis. Will be speaking, and Matt Gainham, who's an award-winning poet, who's also in long-term recovery, will be sharing some of his poetry. So I think there's something there for everybody to get educated and start to learn about this crisis.
So Eric asks, are you offering help for those that want it? So if someone in the shoes of an addict in the family or themselves an addict, can they show up and get help?
So we are going to have tables in the lobby at the Zeiterion with some of the treatment centers who will be kind of handing out some of their materials, and we will have some of our social workers there speaking about how to navigate the system so that people can get into treatment.
Is this a one-way conversation? You're just going to talk and everyone has to listen, or how's it going to go?
The goal, it's funny, I think a lot of times as physicians we should probably talk less and listen more, and that is going to be our goal tomorrow night. So we've asked the physicians to kind of keep their speaking points very brief, so that we do have time to open this up for a question and answer session at the end. I think when we have all these resources pulled together in one place, it's important for people, number one, to be able to just speak and share their stories, voice their concerns, and ask questions about anything that that they may have on their mind.
So you're the co-founder of PPOA, and now there's also a nurses group as well. So why did you guys start that?
I think it's just it gets to a point, I think, where enough is enough. Myself and Dr. Rocha grew up here, and even in the 7 years that I've been at St. Luke's, the number of overdoses that we've seen, the number of fatal overdoses we've seen, the kind of cases of opioid abuse that we've seen, like everywhere else in the country, it's just grown exponentially, and it's not getting better. I think that what we always say is kind of an extraordinary crisis takes extraordinary effort, and that's what we're trying to do here, is to mobilize resources to help people who are kind of already in the throes of addiction, and as important or more important, to get to kids when they're young and start letting them know what is going on here and how to kind of avoid falling into some of these traps.
My challenge is that people show up tomorrow, because we say we care about the community, we say we care about the opioid addiction. We put a ribbon on our profile on Facebook. We have doctors willing to come out, and it's something, dozens of medical professionals, you have police officers, you have people like Denise, other people have been affected, but we want to sit at home and kind of just not put in the effort. And this is a chance to come out, get educated. Everyone knows someone that's been affected by addiction, so if they don't want help, you can go try to help get information to bring back to them. So I'm going to keep harping this in this discussion is, if you don't show up, you can't fix the problem. We can't be social media justice warriors. We have to be in line to what we see today. Go out there, share your story, come out. So it starts at 6:30 at the Zeiterion Theatre.
Doors open at 6. The program will start at 6:30.
So it starts at 6:30. How long do you think it'll last?
I think, like I said, we want to try to have all of the kind of formal program done in an hour and 15 minutes, and then we'd like to open it up for question and answers. So I think most of us are willing to stay as long as people want to participate in a discussion and have questions that need to be answered.
So Frank Ross asked, so he's a statement and a question. We've been hearing about the adverse effects of opioid addiction for the least 50 years. I'm not sure. In schools, DARE, through media, everywhere else. Who doesn't know opioids are highly addictive and dangerous? What are you going to tell us we haven't already heard?
I think that there's probably a lot of things that you have heard, and I think part of what we're trying to do here is end the stigma that's associated with this. Because I think we all know that ignoring something, doesn't make it better. And, you can see even some of the things that people post on social media about, so-and-so's a junkie and this, that, and the other thing. You're not helping the problem. I don't think that anybody, and nobody goes out there and wants to be an addict. Nobody tries to be an addict, but more and more people end up addicted, to opioids. And I think that there's a lot of misinformation. I think that there's a lot of stigma associated with it, and I think opening it up and having a discussion and erasing some of that stigma is a big part of moving forward with this.
So Denise, talking about your son, so how did he overdose or die?
Heroin overdose. He was ready to go back into treatment because he knew that the judge was going to order him back once he had taken a urine test. So he knew he was headed back there, and he just figured he would have one more fling before he went in, and it was too much because he had been clean for 6 months.
Who do you blame for what his life choices and what happened to him? Do you have was there enough, well, let me ask this first. Was there enough resources back, and this is just about 4 years ago, right? So
there were the resources, but I don't think that I think part of me was in denial when he was doing it. And when things really got bad, I had him sectioned, and I began to read up on it and look into it to see what I could do as a parent. Being a single parent isn't always the best. So.
Do you mind talking about that day? Did he overdose?
Mm-hmm. The night before, I had gone to do an airport run in Boston, and when I came back to the house, he and his brother and girlfriend were at the house, and I kind of knew before that because I had met up with him. He had wanted $30 supposedly to put gas in his girlfriend's car. And I said to him, he was with a friend, and I said to him, "You're using again." And he said, "No, Mom, I'm not." And I said, "Brett, I can tell by the look on your face." And I left, and when I came back, he was at the house and they were cooking, and he came up to me and he said, "I'm going back into rehab tomorrow." And he gave me a hug and a kiss, and I said to him, "You know, Brett," I said, "it's the choices you make in life that create your misery, and there are consequences for your actions." I said, "But I love you, and I'll be there for you, but you have to do this yourself." So I said to him, "When you're all settled, either have your CSP worker call me, or you call me and let me know where you are, and if you need anything." And that was it. I gave him a hug and a kiss. And so that next morning, I had gone, my students were in phys ed, and I texted him and asked him if everything was okay. And he didn't text me back. So I said, "Well, you're probably doing an intake, so please just call me." And his girlfriend texted me and asked me if I had spoken to him, and I said no, and she said that he was talking kind of foolish, that he was going to get the gun from his father's safe, blah, 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 blah. So I called his dad, and because he was staying with his dad, and I said to him, "You do realize your son knows how to break into your gun safe?" And he said, "I'll have him arrested." And I said, "No, you'll probably find him dead." So he went home, and he tried to revive him, but he was too late. So, and I left work, and I went there, and it was kind of hard because I saw him laying there, and the police wouldn't let me in because it was considered a crime scene because he was by himself.
So you probably a proponent of Narcan today.
Yes, and I did have Narcan at my house. Brett had gotten it from somebody a couple of years back, and I hid it in a safe place, so safe that I couldn't find it till probably maybe a year ago.
So what would you say to people why should people come out tomorrow night?
To listen to stories such as mine and others, and to know that there are people out there willing to help, but you gotta want the help.
So Sean asked, is this a free event tomorrow? I have a ton of ideas concerning treatment rehab. Yeah, it's free. No one's got to pay to come out.
Correct.
So it's free. Come out. I'm going to repeat because I really need people to understand where it's at and the time. So tomorrow night, Zeiterion Theatre, 6:30. Could go longer if people come out and really participate. We want this to go long. We want it to be a discussion between the doctors, the healthcare providers, the police, and people affected by addiction. I don't know anyone who doesn't know someone that's been a user or at least affected by someone in their family. So if I get some more questions here.
Yeah, so this is 100% free. You don't need tickets. You don't need to respond to anything, online. Our hope is to pack the Zeiterion, so, just show up. As Dr. Roach always says, the biggest things you have to do to make change are show up and care.
So and I'll get into some of the discussion that probably happened at the Z. Do you think our legislators are doing really enough to take on this, or is it kind of slow behind the curveball here?
I think that they're trying, and part of what we're going to discuss tomorrow are some of the new laws that Governor Baker and his staff have passed, and I think that they should be applauded for their efforts for trying to make some headway in this. I think some of these changes will certainly be effective, some probably more effective than others, and like I said, this is not a problem that doctors are going to fix. This is not a problem that politicians are going to legislate away. This is not a problem that the police are going to fix. It's going to take everybody working together, and I think input from the community and input from people who have lived experience is really going to be helpful in shaping how we approach this as physicians, how our legislators approach this, how the police approach this. I think we need to start thinking outside the box a little bit, because we know the things that we've done aren't working, quite frankly.
So Tricia Livesey says, great job, Denise Wood and Dr. Longo. Monica Rocha, I love you, Denise Wood. So she's supported here for you. So you got people coming in here. Can't stress enough, we're going to do another live stream today at 5 o'clock. One of the nurses. We can't solve this problem from behind a keyboard. We can't solve this problem talking to people that agree with us. We have to come out and have a community discussion. New Bedford needs to get rid of its apathy of not showing up to these things. And I run New Bedford Guide, and I just know what happens. We have these events and people don't show up. I challenge you to come out, challenge your friends and family to come out. We have doctors, survivors, people willing to share information. And if you know someone that's going through this kind of issue with addiction, bring them or come out and find resources that are there. We're going to have a website this week that'll launch that's going to have resources and provide information. It's going to list all the doctors that are part of this. These guys care, they're trying, they get a lot of blame in the media, but they really are trying. Sometimes you'll learn how their hands are tied on many things, and if we all sit around point fingers, it's not going to solve itself, okay? So we don't have any more questions. Here we go, addicts. So you want to close with anything?
I think we just need to turn out. Like I said, if you're not affected personally, this is a huge issue for the community and the country as a whole. Come out, get educated. If you're not being proactive and being part of the solution, then you're only contributing to the problem. So I hope that we can fill the Zeiterion tomorrow. I hope to have an engaging discussion with people from the community, and hopefully can provide them with some education and resources that are much needed.
And I want to thank Denise it's very brave to talk about what happened, and she's taken on the issue and not hiding behind it, and we love people like that can come out and talk about it and help other people. So you lose a loved one, it's great to see people coming out and caring.
I'd like to put a challenge out to all my family, friends, and my son's friends to come out and step up to the plate like I have. So
let's come out, let's fill the Z, let's have it so these people have to stand outside, and we show people in this area that stigma is wrong, and that maybe people come out of the woodwork because they see that the community actually cares. Let's not send a negative message and have 20 people show up to the Z. We need you out there, so come on out. So thank you, both of you.
Thank you.